But he just said, look, based on what I'm seeing with your imaging, this is, your level of activity in your life is going to largely depend on how much pain you can handle. And it's not going to get better. He said, you're on the track to a knee replacement. You've got some pretty significant arthritis and your meniscus is damaged, and none of that stuff is gonna get you better. I'm 35. I've got wife, 2 kids, live a pretty active lifestyle. I got some cool hobbies, love wakeboarding, surfing, basketball. I'm a track coach, so do a lot of that stuff. I was a 3-sport athlete in high school. In 2003, I was playing football. It was a scrimmage before our season started. It would have been my junior season, and caught a pass over the middle, went to make a cut in between a couple defenders and felt a nice big pop in my knee and knew something was up. So sat out, had the doctor take a peek at it. They didn't think it was too badly injured at that point. They thought it was a sprain, so I sat out for a couple of weeks, waited for the inflammation to subside, and then went back to practice and caught a deep pass and went to stop and make another move, and that's when I knew it was over. It was a very unique feeling, and I was obviously pretty devastated. It was junior season of high school. I was primed to have a pretty good year, and it was all over at that point. I had surgery. They told me it would be 9 months before I was doing anything high impact. I would say it was probably a solid 6-7 months before I actually felt pretty comfortable. So I would notice from time to time during track season that it was painful, but consistently started being a problem when I was probably 23 or 24. So it's been over 10 years that it's been a pretty consistent, difficult to control the inflammation, pain kind of always there. The swelling was almost constant. It was just in a constant state of inflammation. And when it was at its worst, it was wakeboarding was difficult, which was heartbreaking for me. That's a big part of my life and happiness. Cut my run short, or it would make it where I would have to not wakeboard certain days.
Yeah.
Back-to-back days was difficult.
Yeah.
And so I would just surf on the second day, or maybe not even get in water at all, which is really hard for me. Anybody that knows me knows that you can often measure my happiness by how many board shorts are in the hamper at the end of the week because they're wet from the river. But my wife forced me to make a doctor's appointment, so I went in, but he just said, look, based on what I'm seeing with your imaging, this is, your level of activity in your life is going to largely depend on how much pain you can handle, and it's not going to get better. He said, you're on the track to a knee replacement, which was really difficult for me at 24, right?
Totally.
I think one of the things that really scared me a lot was I remember as a kid, that 10, 11, 12-year-old kid, I was all into basketball. I was geeked about basketball. And my dad was a pretty good basketball player. And I remember finally being at an age where I could play basketball. I could play pickup basketball with my dad. And it was always my favorite thing when we ended up on the same team. And so the idea at 24 that I maybe not be able to do that with my kid was terrifying. It was brutal. And my son loves basketball. And so someday there might be a day where we get to do that. But when I had this appointment with my doctor, I was convinced that wasn't going to be the case. That was rough.
We've also helped hundreds of patients like Jeff alleviate their pain using regenerative medicine. And by doing that, we've been able to avoid things like steroid injections, surgery, get them less pain, sleeping better, and more active. After getting Jeff's history on his pain and a full physical exam, we reviewed his imaging and came up with a plan that was tailored to his knee and to his injury. And we determined what would be the best procedure. We discussed what to do before and after to make sure it had the best effect. We also discussed supplementation to optimize healing and recovery. We also discussed his rehab protocol for after the procedure. We also provided some alternative treatment options to help optimize the recovery process.
Never break, always fight, never quit, do it right, play the game, win it life, got no shame, there's no time, feel the pain, live the grind, I could change, in my mind, pick a lane, committing climb.
Okay, so I'm gonna go get this spinning. I'm gonna do that shot, and then we're gonna pop back in and do all the other stuff in a minute. Cool. Ready?
I got time to feel, I took the red pill. I know life's short, so I wanna live real, but how's it supposed to feel? How's it supposed to feel? How's it supposed to feel? They wanna say my name, but they holding back. They wanna say they hate, but they know it's good. I ain't playing no games, I just do that's fact, and I don't feel no shame. It's a mood you act like crazy. Nah, I ain't lazy.
Got me cold sweating, Mark.
Pass me the jack, right as fuel, got me hazy. About to unpack all these shit I've been chasing. I've got visions in my head, like memories after death. To be a legend instead of something you can forget. I'm living up every breath, I'd rather lead than be led. I'll fill the seats as I spread with every word that I've said. How's it supposed to feel?
I was expecting it to be pretty painful, but it was really tolerable. It was not as painful as I anticipated it being. This is helping a ton. This one's still a little sore, but yeah, I don't know if it's the heat or what, but it really is helping. Six months, right? Post-procedure. Few things that I've noticed big differences with. One being much less pain and inflammation, but the other is recovery time. I've really kind of started to ramp up on my normal activities, playing basketball once or twice a week. I spent the summer wakeboarding, surfing, doing all that stuff, and now that it's winter, started snowboarding again and noticed quickly way less pain, endurance, feel like I can run longer. We're avid wake boaters, and my mind says you should be able to ride every day. Last summer, if I was riding back-to-back days, I had to take 2, 3, 4 days off to let my knees recover, swelling go down. Last summer, lots of ibuprofen, a little bit of ice, and it would take days for inflammation and pain to go away, especially in the front of my knees. This summer, I didn't have that issue, and I was riding pretty hard, multiple days in a row. We were getting after it. That part of it's been really fun because it's almost like it's like I get to go out and test what I'm capable of again. That's always exciting. Going into snowboard season now, it's like, man, I can't wait to get up there and see what the differences are from last winter to this winter. Last year, I had to bail out because my knees were smoked and I was hurting and couldn't do it anymore. And so I'm really looking forward to that part, because I don't think that's going to be the case this year. Something small, but I'm getting ready for basketball a couple weeks ago, and I'm stretching, and I'm realizing as I'm stretching that my range of motion is way better. You know, I can bend my leg a lot farther than I used to be able to. I haven't sat crisscross applesauce since, I don't know, 2005. And I'm sitting on the floor in my living room, and I try it out, and I'm sitting there pretty comfortably without issue, and my wife looks down at me on the floor and she goes, "What the? I don't think I've ever seen you sit like that." You know, so it's something small, but it's big for me. You know, little things like that, having the range of motion, especially with my little critters, being able to move around a little bit better with those guys it's awesome. I guess the last thing that I will say is, if you're like me and you've had knee issues and you're struggling to find the right fix or option, and you're told cortisone shots, knee replacements, take ibuprofen, there's another option. This has been a huge blessing for me in my life, and I would recommend this to anybody, family, friends. It's made a big difference for me in my life, and I would highly encourage, if you've thought about it, to take the step, make the call, get in touch with Dr. Musson and make this thing happen, because it's made a huge difference.